9933. Good to see you again.
Good to be here.
Let's get to the phones. We will start with Rick in Westfield. Hi, Rick.
Hi.
Hi, what's your question?
I have a treeing walker coonhound, and on his left rear leg, he started out with a sore about the size of a silver dollar, and he's been licking it and chewing it, and it's increased further down his leg. I've been treating it with Aquaphor and then wrapping it up, but of course he chews that off, and then when it starts to scab over and heal, then he starts licking it some more. So I was wondering how I could do to help.
Yeah. Do you use him for coon hunting?
No.
No. Okay. This sore, he wants to lick it all the time.
Right.
Yeah.
Well, not, it'll go in periods when it starts to scab up again, and I suppose it itches, then he starts to lick it again.
Okay, well, the first thing that comes to mind is a thing called a lick granuloma. This dog will pick a spot on a leg and out of boredom or whatever, will lick it until it's raw, and then they just lick and keep it going. And steroids are usually used to treat it, wrapping it, different salves to keep it away and them away until it's completely healed. But there are other possible causes too, and that should be checked before you just treat it. Like,
you should find out what caused it in the first place.
Right. If it's an infection or could be even a cancer of some kind. So it needs to be seen and then treated accordingly.
And it's the dog's instinct to lick it.
Well, yeah, sure. Any wound, any dog will lick it, but sometimes they get carried away and they'll just lick forever and they just make the whole leg look like that. And it can be a challenge to get it solved. So.
All right, let's go to Tammy in Madison. Hi, Tammy.
Hi.
Hi, what's your question?
I have a black lab that's going to be 9 years old, and he's got these bumps, like several of them on his body, that it's like, looks like it could be blisters, but they're not because the skin is thicker. And it feels like there's fluid around there. They don't move around.
They look like fluid-filled cysts?
Yes. Yeah.
Well, they could be, which older dogs get things like that, but there's a tumor that looks a little bit like that sometimes called a mast cell tumor. And that should be checked, and if it is that, they need to be removed.
Yep, so go to the vet and check it out.
Get that one checked out.
My late dog Esty had both.
Ah,
so yeah, so you gotta keep an eye on those things.
Right, you gotta discriminate or determine which one it is too. Yep.
All right,